The topic of this mini video is anxiety. There are quite a few types of anxiety disorders, and the most common ones are generalized anxiety disorder, panic disorder, and social anxiety disorder. Social anxiety disorder. So, again, feeling anxiety, feeling anxious, feeling worried, feeling unsure about what's going on, even feeling panicky in some dangerous situations is normal. It's a normal part of being human. But anxiety can become a disorder when yes, when it interferes with your ability to function in everyday life and when it lasts for 2 weeks or more. So it is very normal to feel anxious before a test, but it is not normal to lose sleep the night before and to be able to think of nothing else besides the test and not be able to eat the night before or the morning before a test because of anxiety. So the anxiety doesn't normally, when we feel anxiety, it goes away over time. But with someone who has anxiety, it doesn't go away. And in fact, it likely gets worse and worse and worse. You can imagine how this would interfere with your ability to perform at your job, at school, and to engage in normal social relationships. So, every anxiety disorder, each category, generalized anxiety disorder, panic disorder, and social anxiety disorder, there are others. Those are, for example, any phobia that people have is categorized as an anxiety disorder if it interferes with their ability to function in everyday life. So, for example, spiders are not my favorite thing. But if there is a spider in my house, I can take care of it, or I can hang out until somebody who comes to be able to take care of it, until somebody comes who is able to take care of it. Um, I don't freak out and have to leave the house or not be able to be in my own house for a period of time for whatever reason. Okay, so excessive irrational fear and dread are what the symptoms that what they all have in common. So about 29% of Americans will experience anxiety within their lifetime, and that is really right about the same amount of people who will experience depression in their lives, and depression and anxiety can actually go hand in hand. Anxiety can be a symptom of depression. So, the affected part of the nervous system, again, we are pretty sure, we're not absolutely sure that this is what happens, but scientists think that it's the part of the brain that manages fear. So, it's a dysfunction of the part of the brain that causes us normally to be fearful or worried for healthy reasons, for survival types of reasons, and somehow those get out of hand. So, in generalized anxiety disorder, people who have this can't seem to get rid of what they're worried about. So they usually, and here's the tricky thing, the I think maddening thing about anxiety is that this part of your brain that controls fear is very, very deep in your temporal lobe. It's very just above your brainstem. And that part of your brain is what's causing this constant worry, constant anxiety, constant revisiting of whatever the concern is. This part of your brain is the one that's able to say, "Hold on, this isn't that big of a deal. We can handle this. Let's make a plan. Let's talk to some people who can help us solve this problem or who can help us get through this." This part of the brain can think rationally about the problem, but the deep, deep part of your animal brain can't and continues to spiral. So, people with generalized anxiety disorder struggle to relax. They startle easily. They struggle to concentrate. They often have trouble falling asleep or staying asleep. People with anxiety typically don't sleep for long periods of time. These people are not having trouble getting out of bed in the morning unless it's because they haven't slept all night. They often have physical symptoms, which may include fatigue, that tiredness, headache, muscle tension or aches, difficulty swallowing, trembling, twitching, irritability, sweating, nausea, lightheadedness, having to go to the bathroom frequently, or feeling out of breath. So once again, a mental health issue that has physical health symptoms. Okay, panic disorder. Uh, Symptoms of this include sudden and repeated attacks of fear, a feeling of being out of control during a panic attack, an intense worry about when it's going to happen next, fear or avoidance of places where panic attacks have happened before, physical symptoms such as pounding or racing heart, sweating, breathing problems, weakness or dizziness, feeling hot or cold chill, tingly or numb hands, chest pain, or stomach pain. So, students, I can relate. I do not have panic disorder, but I have panicked before. I have claustrophobia, which means that I'm not really afraid of them, but I avoid small, closed in places. If I have a chance to take the stairs, I will take the stairs every time before I take an elevator. I hate sleeping on the bottom of bunk beds, and actually, that's where a panic attack my first and second panic attacks of my life happened in bed because I felt trapped as I was trying to go to sleep or in the middle of the night. One of them, I woke up in the middle of the night. So I don't like places where I feel trapped. And my head is saying, I'm safe. I'm in bed. But that fear part of my brain is going, you can't get out. What if something happens? You're trapped. It was the blankets that were holding me there. And then feeling like that top bunk was closing in on me. So this part of my brain is like, no, you're safe. Calm down. But the fear part of my brain was going, get out while you can. Okay, social anxiety disorder. So people who have this tend to be anxious about being with other people. So it could be that they just have a hard time talking to people, and it can be people they know well. It could be people they don't know well. They might be very self conscious in front of other people, feel embarrassed to be around other people. They often have feelings of fear that other people are judging them, and they worry. The anxiety can kick in days or weeks before they have an event where other people will be. Um, they may stay away from places where they know other people are going to be, have a hard time making or keeping friends. They may have the physical symptoms of blushing, sweating, or literally shaking. Announcement. Okay, that would be me. Uh-huh. I have to do my symptom check. No. Submit. All right, there we go. I'm symptom free. So, I don't know if you heard that or not, but that was Mr. Um, Saint telling us we have to do our COVID symptom check. So, people who have social anxiety disorder, trembling, sweating around other people, and they actually may feel nauseous, like they're going to throw up, or actually be sick to their stomach when they're around other people. How do you get anxiety? What is the transmission of it? We don't know for sure. What we do know is that increase in cell phone use and increase in younger kids having cell phone use, and it seems to be somehow connected to social media as well, um, has increased the amount of anxiety that we see in kids your age. So it is important as you use your phone and social media to make sure that you're using it in a healthy way, in terms of time, and then also in terms of the content that you are allowing yourself to see, and the things that you post yourself um, are important in managing possible anxiety. So, what can be done to help anxiety? In general, it's very much like depression. So, it is treated typically with medication, therapy, or in many cases, both. So it also depends on the kind of disorder. For example, if a person is experiencing social anxiety, they're not going to have the same kind of treatment as a person who has generalized anxiety. So the counselor, therapist, psychiatrist is going to tailor their treatment of that person to the person's type of anxiety. All right. That would be it for anxiety. And once again, it is normal for you to feel worried or tense or anxious in everyday life. It is a problem when it interrupts your ability to function in everyday life and lasts for 2 weeks or more. Please ask for help if you think you need it. All right, then. Goodbye.